The essential nature of oxygen in your blood cannot be overstated. It is the very essence of life. Oxygen inhaled through the lungs is swiftly captured by red blood cells and circulated throughout the body, providing vital energy to every organ, tissue, muscle, and cell. Sadly, many suffer from reduced levels of blood oxygen, a condition that can insidiously impair the heart, brain, and liver over time. A variety of factors may lead to this reduction, with chronic respiratory ailments like asthma, emphysema, chronic obstructive pulmonary disease (COPD), bronchitis, or pneumonia often at fault. The habit of smoking directly affects the blood's oxygen retention capabilities by negatively impacting hemoglobin. Furthermore, an elevation in cortisol levels due to stress or anxiety can provoke excessive breathing, which upsets the natural balance of oxygen and carbon dioxide within the bloodstream. Conditions such as snoring and sleep apnea also contribute to this decline in oxygen levels. An overconsumption of sugary substances can lead to a more acidic bloodstream, thus lowering oxygen levels. Moreover, a lack of essential nutrients can result in anemia or diminished antioxidant levels, which, if not addressed, could escalate to hypoxia, causing grave damage to the body's organs. We will explore 9 telltale signs and symptoms pointing to reduced oxygen levels in the bloodstream in this video. It's imperative to seek medical guidance should you encounter these symptoms. The initial sign, often referred to as air hunger, is a compelling desire for more air due to insufficient oxygen levels, leading to feelings of chest tightness and frequent deep sighs. Acidic blood hampers oxygen delivery, resulting in this distressing sensation of breathlessness. Becoming dizzy or experiencing significant weakness upon standing or engaging in light activities is another sign. Such symptoms may suggest a shortage of oxygen in your blood, causing moments of imbalance or fleeting blackouts, particularly around your field of vision's edges. These indicators imply that your muscles are not receiving the necessary oxygen, resulting in a pronounced weakness. A quickened heartbeat, normally pacing at 60 to 100 beats per minute at rest, can also suggest low oxygen levels. By placing 2 fingers on the wrists inside, one can measure the pulse rate. An elevated resting heart rate, or a palpable heartbeat while resting, signals the heart's struggle to pump more blood to counteract the reduced oxygen supply. Moving on to the next sign, muscle cramps and chest discomfort can also signal an oxygen deficit in your bloodstream. If you often encounter such pains, it may be advantageous to integrate foods high in electrolytes, vitamin E, and B vitamins into your diet to improve blood oxygenation. The video will delve deeper into methods to boost oxygen levels. If you find this content useful, please support the video with a like, subscribe for further health insights, and turn on notifications. The 5th sign is the sensation of heavy legs when ascending stairs or walking. Even a minor incline causes breathlessness. It's likely due to insufficient oxygen in your blood. A feeling of intense weight in your thighs and calves can be a sign that oxygen is not adequately reaching these muscles. This could be attributed to a weakened cardiac condition or a lack of vitamin C or E, which are crucial for muscle vitality and often linked to the sensation of leg heaviness. Inspecting your nails can offer clues to the 6th symptom. Nails that are pink, smooth, and have barely noticeable fine lines are generally a sign of robust health and adequate oxygenation. Continuing with the 7th sign, you might notice changes in your skin's coloration. Healthy skin should have a uniform, pinkish hue, but if you observe bluish or grayish tints, particularly on your lips, inside your mouth, or on your fingertips, it could be cyanosis, which occurs when oxygen levels are dangerously low. Such discoloration demands immediate medical attention, as it suggests severe oxygen deprivation. The 8th symptom is cognitive disruption. Oxygen is critical for brain function, and when it's scarce, you may experience difficulties in concentration, short-term memory, or even decision-making. Mental fog, confusion, or an uncharacteristic decline in cognitive abilities can all be indicative of low oxygen levels affecting brain health. When your nails show a marked paleness with a distinct lighter strip of color adorning the top, this subtle sign could be alerting you to the presence of anemia. This condition denotes a shortage of hemoglobin, a crucial component in your blood responsible for ferrying oxygen to the extremities, including the nail beds. Furthermore, if your nails tend to break easily, or if you notice that once fine vertical lines have deepened into more prominent ridges, these symptoms could also be pointing toward anemia and possibly even nerve damage in the area of the nail bed. The 7th symptom, stemming from low oxygen levels in your blood, is the appearance of a blue discoloration on the skin, a medical condition referred to as cyanosis. This typically manifests as a bluish tint on your skin or lips and is a direct result of insufficient oxygen reaching the body's tissues. Cyanosis can appear suddenly and is often seen in tandem with episodes of shortness of breath. It's a severe and noticeable symptom that signifies the urgent need for medical intervention. The final symptom we'll discuss is confusion, which manifests when the brain isn't supplied with sufficient oxygen. Symptoms may include disorientation, an overwhelming sense of fatigue, and a marked increase in irritability. These issues are frequently linked to a deficiency in vitamin B1, also known as thiamine, which is pivotal for nerve and brain health. Excessive consumption of sugar and refined carbohydrates is a common culprit behind such deficiencies. If you're experiencing any of these symptoms, it's advisable to seek a professional medical evaluation promptly. A healthcare provider may use a tool called an oximeter to measure your blood oxygen levels. A normal saturation level typically lies between 95 to 100%. However, if the oximeter consistently shows a reading below this range, especially below 92%, it points to a potential underlying health concern. Alternatively, for those interested in self-monitoring, one can purchase a pulse oximeter for home use, a convenient and relatively inexpensive device that clips to your finger and provides an immediate reading. For your convenience, I'll include a link to a selection of pulse oximeters below the video. Moving forward, let's consider 6 strategic lifestyle practices that can effectively enhance your blood oxygen levels. 1. Focus on incorporating foods into your diet that are abundant in heme iron, which is primarily found in animal proteins. Oily fish, shellfish, quality grass-fed beef, and liver are exemplary choices, as they also boast a rich content of vitamin B12. This vitamin collaborates with iron to boost the production of red blood cells, thereby improving the oxygen storage and transportation throughout your body. 2. To elevate your oxygen levels, it's essential to curtail the consumption of refined carbohydrates such as sugary snacks, soft drinks, and processed grains. These include flour-based products like bread, wheat items, pasta, pancakes, and biscuits, all of which are known to drain your body's antioxidants and contribute to acidic blood, which can diminish oxygen saturation. 3. Enrich your diet with foods naturally high in vitamin E to promote heart health and enhance oxygen delivery. Such foods include, but are not limited to, sunflower seeds, avocados, the purest forms of olive oil, hazelnuts, Swiss chard, and a variety of leafy green vegetables. Consider supplementing with a potent form of vitamin E, known as tocotrienols, to reinforce your diet. 4. Cultivate a routine of leisurely strolls through lush areas filled with plant life. Commit to at least 30 minutes of gentle exercise in the outdoors daily. The combination of physical activity, the fresh air quality, and the therapeutic essential oils released from trees contribute to improved circulation and better oxygenation of the blood. 5. Make it a habit to consume low-glycemic berries each day. These nutrient-dense fruits, like blueberries, strawberries, gooseberries, and acai berries, are laden with antioxidants and the beneficial compound resveratrol, known for its ability to boost oxygen levels. Furthermore, staying hydrated by drinking a minimum of 1 liter of mineral water daily aids in the oxygen exchange and supports overall bodily functions. A recommended recipe to start your day combines the potent nutrition of berries with a dash of natural salt, mixed into sparkling mineral water to create a revitalizing and healthy beverage. This drink not only helps in increasing blood oxygen levels but also replenishes vital electrolytes in your body. 6. Lastly, practice abdominal diaphragmatic breathing. This simple yet effective breathing technique involves placing one hand on your stomach and the other on your chest. As you inhale deeply to a count of 4, ensure that your abdomen expands while your chest remains relatively still. Then slowly exhale to a count of 6. This method not only aids in enhancing air distribution within your lungs, but also serves to lower cortisol levels, promoting a sense of calm and relaxation. Try these methods and observe which ones yield the best results for you. In some cases, additional vitamin supplementation may be necessary to fully optimize your blood oxygen levels. Thank you for tuning in. I trust these insights will contribute positively to your health journey. Wishing you the very best of health, wealth, and contentment.